Okay, I think just to be cognizant of the time, really sorry. We I think can start with Adi. Adi represents 7Sugar. So over to you, Adi. Really looking forward to your presentation as well.
Thank you.
Thank you, Saurabh.
Are you able to see my presentation?
Yes, we can.
We can.
And just the same reminder again, very much in line with 7Sugar, 7 minute would be like a great time to keep our tabs on. Thank you so much.
Okay. So I'm going to start the slideshow. Hello. Yeah. Are you seeing my presentation? Hello.
We can see the presentation. Adi.
Okay. All right. Great. Thank you. For having us. This is Adhi, co-founder of 7Sugar. I'll be talking about how 7Sugar is empowering doctors, to deliver superior clinical outcomes. So what is our promise to doctors, right? Well, we want to assist doctors to improve patient compliance and deliver better clinical treatment outcomes. And second is that we want to regularize patient engagement and build long-term patient relationship. We believe this is the key to better glycemic control over time, because diabetes at certain stage tends to stay with you, and our goal is to make sure that you're in glycemic control as long as possible so that you can ward off complications. And we want to boost patient engagement. These are the three things that we want to deliver using 7Sugar, and we want to do this all without the burden of time. I know this is very important because doctors have limited time. We want to make sure that we deliver this without the burden of time. And how do we do it? We have built a solution which is a 360-degree approach to deliver personalized diabetes care using more than 1,000 data points. The first is, as you've seen, many startups that are there in this space, we all track somewhat similar type of data, which is physical activity, food, your vitals, your prescription, your sleep. And then what we do is, we actually analyze these parameters, and then we share them with the team of care providers. It could be the doctor, it could be the doctor's team, which could include dietitian, or it could be other doctors as well, like a referral doctor. And because of this closed loop system, where doctors and patients are connected digitally and they're able to see the information, we see interventions a lot more precise, and treatment actually becoming a lot more targeted, and patient getting better sooner. This is our a block diagram of our app. It looks, we have a mobile application that takes in all the data. Then we store it in the EHR EMR, and which is longitudinal data. Then we have a lot of powerful data analytics platform which crunches this and shares insights with the healthcare practitioners. We also share insights with the patients wherever we see that patient can take control of things. And this closed loop continues until we reach a target of the patient and the doctor is aiming for. Beyond that, they can continue to stay in the app, and then monitor them how they are maintaining their stable health. So I think the key for us is the data analytics platform, which forms the core of our IP. Here are some sample screens, where we show what the patient would see when they log in. They can check their time in target. They can look at their calories consumed, steps. They get an agenda for what they have to do on a daily basis. Every meal is analyzed for calories with the use of a simple photo. And so we've seen excellent engagement from patient with what we have provided. And then we also, what we do is we regularize patient engagement for the doctor. For example, post consult we work with the patients to increase patient compliance, vital tracking per protocol, out of range alerts. And then pre consult we provide them with labs, appointment reminders, symptom tracking, and we also give them a 7Sugar personalized report, which is a proprietary report that we have developed. The combination of the two, the activities that we do post consult and the activities we do pre consult, which makes the consultation time at the clinic super effective, because it is no longer history taking, it's more about counseling, which is very precise, and which is more about cause and effect understanding, for the patient, and so it becomes very effective. We also provide custom protocols, unparalleled level of customization. Doctors are able to customize their the app around 30 dimensions to tailor to their practice, and because of this, we can address a variety of use cases. And here are some of the things that we have seen on our platform. In fact, we have seen some more, but broadly, these are the things that are, the majority of the cases, that we have addressed. pre-diabetes, early, late to gestational obesity-related issues. So, and what is the impact so far? More than 70% of the patients on the platform have seen improved time in range. 1.7% A1C reduction in 3 months. That's a 90-day period, which is quite dramatic and quite impactful. Many thousands lives have been served by on our platform. We have analyzed hundreds and thousands of meals that our patients have submitted on our platform. And every report, we can see at least 20 actionable data points that the doctor and the patient can use, because of which our interventions are highly targeted. Now, after all this discussion, right, when you show this to the doctor says, Adhi, you guys have done a fantastic work, congratulations. But I'm really concerned about many things. The first question is going to ask is, are you guys like this company? I'm not going to name that. That is the first question they're going to ask. And my answer is that, we do not have ratings on our platform. We do not show ads on our platform. What you do with your patient data is your business. We don't mess with it. And patient can see only you and your care team on the app. Even though we have many doctors, every patient sees his own doctor and every doctor sees his own patient. So nobody knows, who the others are. Then the next question that comes is, hey, I don't have time to explain your program to my patients. My OPD is full, which is the case for most diabetes patients, right? Most diabetes doctors who are practicing diabetes. So our answer is that, we'll onboard the patient onto the program for you. We'll handle the patient to, for them to understand the value of sharing information so that, your doctor consultation next time becomes more effective. And then your staff, the doctor staff or our diabetes educator can answer basic patient questions. So this, we provide a layer so that, doctors are not disturbed all the time. This is a very important service, doctors appreciate a lot. And then, we provide a very simple report, where data is analyzed in intuitive and interactive manner. Now, this is the key because, our reports are highly valued by doctors. Then the question comes in, what about privacy and security? Again, the doctor can approve who can now have access to data. We have the state-of-the-art cloud security. We're building another layer of security, by collaboration with an ex-Apple infrastructure head for digital services. We've seen the product, we really love it, and so we're going to bring it in. Then there is no third-party sharing of data, on our platform. So that's kind of a thing that we do for our doctors. There's many more concerns we address for our doctors, because of what we do. But I just wanted to share some of the top ones. Again, just to reiterate, we want to assist doctors to improve patient compliance and deliver superior treatment outcomes. We want to regularize patient engagement and build long-term patient relationship. We also want to boost patient engagement. Again, we have a bunch of services we provide to the doctors, which will help them improve, boost patient engagement. And many of the doctors want to avail of these services where they cannot provide on their own. Again, we do all of this without extra burden on time of the doctors. Some of the doctors' feedback, Dr. Karthik Balchandran, Dr. Om Lakhani, it's important to be aligned with platforms that genuinely focus on doctors' interests and patient interests. Dr. Tej Latia, she's an endocrinologist practicing in Mumbai. She says, it has simplified my management of diabetes patients. The general feedback from doctors is, 7Sugar is designed with the practitioner needs in mind. So we got some great feedback, and of course, we've gone through the troubles of fixing all the bugs when we launched, which is the case with any digital startup. I think we're in a very good place for us to expand and scale. And so we look forward to support from the medical community to take this up, and we are aligned with your interests. The platform is designed for doctors. So we look forward to your support. Please visit our website www.7sugar.com, and where you can download our app or you can submit your request, and we'll do a webinar for you. That's my presentation. If you have any questions, I'm happy to take care right now.
Thank you, Mr. Kesarla, and we must congratulate you for bringing this wonderful platform. And I'm sure thousands of doctors are watching this. You may be seeing only few faces here, but this meeting is actually live stream, and we have thousands of delegates who have joined us from all across the world, and they are all listening to you. They are all seeing these products, and these talks which you have delivered here will be available on our platform, that is doctube.co.in, and it will feature there. so that we will share the links with you, so anybody can watch it later also. And next time I will request you, when that one more thing which you can do is that you also try to present some data also, that how it is benefiting. So when you join us in the next World Congress of the Diabetes Technology, and this is going to be a face-to-face meeting, and I'm already informing all of you in advance. So we want that something, now we talk something next. So we have introduced our platform. Next time I request everybody who has presented here to come up with the data, and we would like to, all of you to have paper presentation, poster presentation, and the talks.
Sure. Just Amit, we have seen 1.7% reduction in A1C, on the patients that are on the platform.
Very good. Very
and
good.
nearly is 80% improvement in time in range, which is a new measure that we're using.
Wonderful. Wonderful.
Thank you.
Dr. Ami, I think you had a...
Yeah, no, I just wanted to just really say what Dr. Amit just said. We may be a few faces seen right now, but we have thousands of delegates joining us on doctube.co.in. So many people are listening to all the startups, and everyone's doing a fantastic job. I think we are to the last presentation now.
Yeah. Thank you, Dr.
Dr. Ami,
Thank you.